New studies from the CDC find 2 doses of the mpox vaccine are better than 1. Mpox, formerly known as monkeypox, spread around the world last year, did result in more than 30,000 cases in the U.S. Health officials are warning about a resurgence of the disease this summer. Here to talk more about it, Dr. Pernell. She is a public health physician and regent at large for the American College of Preventive Medicine. Good to see you this morning. So do you share the concern that this summer we'll see more mpox cases?
Well, Marni, it's very much likely. I think the most important thing for the public to know, again, is prevention. How do you protect yourself? So because only 23% of the most at-risk population, and that's men who have sex with men because they were disproportionately impacted last summer, have completed 2 doses. It's very important that we in public health and more broadly get the word out so that people can protect themselves. So we expect to see an uptick during the summer. We know that there will be Pride and other LGBTQ related activities where that population who have been disproportionately impacted are likely to engage. So it's with good reason and good caution to get this word out.
And I'm thinking back to last summer, Dr. Pernell, when people showed up to get this vaccine and there was a shortage, there were certainly lines, there was some frustration and confusion. What's being done, and does it fall on local health departments to provide the resources and the vaccines and get the word out?
Definitely. You know, this goes back to many of the issues that were first unearthed during the COVID-19 pandemic. Our local health departments are just under-resourced, and because they are under-resourced, we have a strain on our national public health system at the state and the local level. Hopefully, we are learning these lessons so that we can be more proactive. And in particular, this summer, we will not have to, restrict or spread out the doses of the vaccine, which happened last year because we didn't have enough supply. So we have the adequate supply this year, but just more broadly, we need to do a better job at public health preparedness, and in particular, when we have outbreaks and pandemics.
Right. And is the CDC doing enough? I mean, even the CDC is going through some leadership changes right now.
I mean, the CDC is at a critical junction in its history. We in the public health community, we have been sounding the alarm, and that the public has lost trust in the CDC. There seems to be sometimes mixed messaging and signals coming from the CDC. Look, I know folks who work there. We have, first-rate public health epidemiologists, thought leaders, and doers on the front lines of public health and well-being more broadly. We just have to make sure that the leadership is given a clear and compelling message and direction, and that there is support at all levels of the federal government for the CDC to be able to do its job.
And the FDA, doctor, backing an RSV vaccine this morning. This is for pregnant women, and it will protect their babies, essentially, their newborns, from this scary virus, RSV. It's especially dangerous for our little ones. It's the leading cause of death for babies around the world. The FDA expected to make a final decision on whether to approve the vaccine in the coming weeks. Although, as I'm reading about this, there is some debate about the risk of premature births. What's the messaging? What are you seeing in the research?
This debate is worthwhile. And what I want the public to understand is that this is what should happen when we have new interventions, in particular vaccines that potentially are about to come to market. We have not had gains in RSV, but now we're at the brink of having 2 significant and considerable gains, one for the older population and now for pregnant women around 24 to 36 weeks, that could potentially provide protection for their newborns at a critical stage of life, whether the first 90 days or the first 6 months. The concern is whether this vaccine in particular increases the risk for prematurity. There is a slight uptick in the data in the studies that have been currently made available to the FDA advisors, but it's not clear that there's a statistical significance or that this is higher than the baseline risk of prematurity. But it's definitely worth the dialogue and debate.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.